Hey guys, this is Dr. Hub. Today we'll look at the abdominal planes. So the important planes will be the transpyloric plane. First let's look at the transpyloric plane. So as the image signifies the transpyloric plane, what do we have? So let's write it down. So the transpyloric plane, it contains, there is a L1 vertebra. Next, there is also the presence of the pyloric orifice, and this is in most of the times. Next, there is also the neck of the pancreas. There is also the presence of the hilum of the left kidney. This hilum of the left kidney. Next is the presence of the ninth costal cartilage. The presence of the ninth costal cartilage. There is the origin of the, so there is origin. So there is origin of the SMA. So SMA stands for the superior mesenteric artery. Next, there is also the origin of the portal vein. There is origin, and this is of nothing but the portal vein. There is also the origin of the renal arteries. There is origin of the renal arteries, and there is a level of the duodenal flexure. So it is a level at the duodenal flexure, and there is the termination of the spinal cord. This is very important. So there is termination of the spinal cord. Next, we are going to look at the subcostal plane. So this was the transpyloric plane. So right below slightly below the transpyloric plane, there is another plane. So this plane is known as the subcostal plane. So it is nothing but the subcostal plane. So what are the components of the subcostal plane? The subcostal plane, it contains the presence of the L3 vertebra. So there is presence of the L3 vertebra, as well as there is presence of the 10th costal cartilage. There is the L3 vertebra as well as the 10 cc. There is a 10th costal cartilage. Next, we move on to the transtubular plane. So this is nothing but the transtubular plane. The transtubular plane, as the image suggests, it is the fifth. It contains the L5 vertebrae, and it is the origin of the inferior vena cava. It is the origin. So it is origin of the inferior vena cava. Then lastly, we look at the paramedian line. So paramedian line is slightly below. So this paramedian line, what does it contain? The paramedian line, it is the mid clavicular point to the mid inguinal point. So it is on the mid clavicular to the mid inguinal. So it is from the mid clavicular to the mid inguinal point, and it is lateral to the ninth costal cartilage. It is lateral to the ninth costal cartilage. Now let's look at the planes. So there is another division of the, that is the division in terms of 9 quadrants. So there is the horizontal plane. So the horizontal plane, what does it include? The horizontal plane is at the level of L3 and at the level of L5. So L3 is nothing but the subcostal. So this is the subcostal plane, and L5 being the transtubular plane. So it is L3, the subcostal plane. So L3 subcostal plane is between the 10th costal cartilage. So it is between the 10th cc, that is a costal cartilage. It corresponds to the third part of the duodenum. So it corresponds to the third part of the duodenum. And then comes, we saw the L5. So what is special about this L5? So this L5 is nothing but the transtubular plane, and it lies between the tubercles of the iliac crest. So it is between the tubercles and the tubercles of the iliac crest. So they are present in the tubercles of the iliac crest, and it corresponds to the origin of the inferior vena cava. So there is origin of IVC, that is the presence of the inferior vena cava. Now let's look at the vertical planes. So vertical planes, it includes the paramedian and the lateral plane. So the vertical planes, there is presence of the paramedian or the lateral. There is a paramedian or the presence of the lateral planes. So they are from the mid-clavicular point to the mid-inguinal point. So the vertical planes of are from the mid-clavicular. So they are from the mid-clavicular to the mid-inguinal point. So the mid-clavicular point to the mid-inguinal point. And they are present on both sides. Now let's look at the 9 regions. So 9 regions, it includes the top right corner, there is the right hypochondriac, and in the center there is the epigastric region, and on the left there is a left hypochondriac region, and there is umbilical region. To the right of the umbilical region lies the right lumbar region, and the left of umbilical region is the left lumbar region. Then in the bottom there is presence of the hypogastric region. On the right there is a right iliac region, and on the left there is a left iliac region. So let's look at some other points to note. There is a transpyloric line. So there are some extra points, that is, there is presence of a transpyloric line. There is the presence of the transpyloric line. So this transpyloric line is aka the Addison's line. So this passes midway between the suprasternal notch and the upper border of the pubic symphysis. So it passes midway, and it is between the suprasternal notch. So it is between the suprasternal notch and also the upper border of the pubic symphysis. Also the upper border of the PS. PS stands for the pubic symphysis, and SSN was the superior suprasternal notch. Let's write it down: suprasternal notch, and the upper part of the pubic symphysis. Next, the other important lines to notice: there is a supracrystal plane. There is a supracrystal plane. So the supracrystal plane, it passes to the highest point of the iliac crest. So it passes from the highest point. So it passes from the highest point, and this is of the iliac crest. So supracrystal plane is from the highest point of the iliac crest, and this is present on both sides. It corresponds to the level of the L4. So it corresponds to the level of the L4 or the L4 L5 or the L4 L5 disc, as well as the spinous process. It is an important landmark when performing a lumbar puncture. So it is a very important landmark for the lumbar puncture in terms of the lumbar puncture, and also for the spinal injection. So what is the most important plane? It is going to be the supracrustal plane. That is the highest point of the iliac crest on both sides, and it is the level of the L4 body. And the bifurcation of the abdominal aorta. So the abdominal aorta bifurcation also takes place here. Next, what is the other important plane? There is a plane at the pubic crest. The plane at the pubic crest. So what is special here? In the plane of the pubic crest, it passes through the upper border of the pubic symphysis. So it is the upper border of the pubic symphysis. So pubic symphysis, we are writing it as PS. So in terms of supine, this plane intersects the tip of the coccyx. So in terms of in supine position, what is happening is, in the supine position, the plane intersects the tip of the coccyx and the femoral head. So the plane, it intersects. So the plane, it intersects the tip of coccyx. So this is intersects the tip of the coccyx and also the femoral head. So we are writing it as the F head. Next we look at the renal angle. So what is special about the renal angle? So we are writing it as R angle, R for the renal. So this renal angle, it lies between the 12th rib and the outer border of the erector spinae muscle. So it is between the 12th rib and the outer border of the erector spinae, muscle, and also it is the lower border of the normal kidneys, may occasionally be felt here. So the lower border of the kidney, it can be felt. Lastly, the important one is the lumbar triangle of Petit. So there is a lumbar triangle of the Petit. So what is meant by this lumbar triangle of Petit? It is found below the iliac crest. So it is below the IC. IC stands for the iliac crest. Let's write crest so it's easier to understand. So it is formed by the iliac crest, and anterior to this lumbar triangle of Petit is the external oblique. So there is external oblique which is present anteriorly. Then there is also the presence, and posteriorly there is presence of the latissimus dorsi. So anteriorly is the external oblique, posteriorly comes the latissimus dorsi, and there can also be the lumbar hernia, it can occur. There is presence of the lumbar hernia which is present.